I'm Amanda Crombie and I'm a registered nurse. My position at Gippsland Lakes Complete Health is as a dementia clinical nurse consultant, and I also do advanced care planning. So dementia is actually an umbrella term that covers a variety of problems that people have with their memory and thinking that's due to abnormal pathology in the brain. There's about 100 different ways that people can get dementia, but the most common is Alzheimer's disease, and other common types of dementia are vascular dementia, Lewy body dementia, frontotemporal dementia, and Parkinson's disease dementia. So in Australia, there's about 459,000 people estimated to have dementia, and about 27,800 of those have got younger onset dementia. So that's dementia that you develop before the age of 65. So that sort of equates to about 1 in 10 people over the age of 65 and 3 in 10 over the age of 85. It's the leading cause of death in women in Australia, and it's the second leading cause of overall disability. So we can classify these as modifiable and unmodifiable. So the one that's not modifiable is getting older, but there are 12 modifiable risks that we can do something about. And it's anticipated that if we can prevent or delay the onset of dementia, we can do that in about 40% of cases if you actually pay attention to these modifiable risks. So those are low education, so obviously getting an education is very important, high blood pressure, smoking, excessive alcohol consumption, obesity, depression, physical inactivity, diabetes, low social contact, traumatic brain injury, and hearing loss. So all the research tells us that if you can start to manage your risks sort of in your late 40s, early 50s, that's a really critical time in your life for you to start to pay attention to your health. So what you can do is manage your weight in a healthy range and be physically active. So those two things tend to go hand in hand. If you're feeling low in mood, don't just assume it's a normal part of aging. Go and talk to your doctor about it and get that investigated. Get social, so volunteer, meet up with your friends, take a walk outside together with your friends, men's sheds, lots of ways. I know it's a bit difficult at the moment, but whatever way you can to stay in touch with people and connected to your community is very, very important. And that's good for not just your mental health, but your physical health as well. And we know those two things are really, really connected closely. Looking after health conditions like your diabetes, high blood pressure, things like that. Stop smoking. There's enough said. We all know it's really bad for us. And drinking less alcohol is generally better. Having some days off from drinking in the week. 21 units of alcohol a week is about the most that you should be drinking, but ideally you should aim for less. And very importantly, if your hearing's impaired, you need to go and get aids fitted and actually wear them. We do know that there is a correlation between hearing impairment and developing dementia, so it's not something that we can just put off. And the other thing is to learn something new, keep your brain challenged, doing puzzles or things that excite and interest your brain is very, very important. What we need to all understand is that our brains don't fully develop until we're about 25 years old, and then from the age of 30 it starts to go downhill quite slowly. So it's quite normal by the time you get to 75 that you can be a little bit forgetful and have a little bit more difficulty problem solving, working things through. But you eventually get to that if you're given enough time. What isn't normal is for you not to be able to find where you've put things and not be able to work things out that you used to be able to do quite easily. But for a diagnosis of dementia to be made, it's more than just having forgetfulness and a little bit of difficulty working things through. It has to actually impact on your function. So your ability to do the things like cook and shop and manage your finances and take your medications effectively. So the diagnosis of dementia is really dependent on you not being able to do those things as well as the other cognitive issues. So what you need to do if you are concerned is get yourself tested. So you can speak to your GP and get a referral, and I can come along and do some testing with you. So we look at all of the facets of your life and put that together into a into a picture that can give you a GP and understanding of where you're sitting. And that can be very reassuring if you're worried and you actually don't really need to be worried, or if there is something going on, you can get it investigated further so that you can understand and make some planning for your future if you are actually developing a process of dementia. But don't put it off, and do get yourself looked at. It's very, very important for you. So thinking about one of the important aspects of health and well-being is being socially connected. And of course, at the moment with COVID, it's very difficult. But we're getting very clever at doing that. So staying connected through social media, through ringing up a friend, talking to people, making sure you actually remain in contact. And it's very difficult now to sit and listen to the news because it's all doom and gloom. But just paying attention to what's going on in the world around you is very, very important, and trying to hold on to those ties. So ties with the community and ties with your family are very important for your mental health and for your physical health. And when you do have an opportunity to go out and do some exercise, do that, because it's also a very, very invigorating and stimulating thing for your body and your brain.